So we're here continuing to speak about research papers that I am looking into and possible clinical implications, understanding that the way that a research paper is framed doesn't absolutely move directly into clinical practice. However, it gives implications that we can take forward. Now, the research paper that I found that I would like to talk about at the moment essentially suggests that if one finger is trained in a tactile fashion or in a tactile task, that adjacent fingers will also go through learning. So if I can train my middle finger in a tactile task, then my ring finger may have some crossover effect, but my index finger definitely will. And what this paper also suggests is that in common use patterns, so we commonly use the middle and index finger together, we don't commonly use the middle and ring finger together. Therefore, the crossover effect is stronger in fingers where we have more common use patterns. Now, that doesn't absolutely cross over directly into a clinical setting. However, if we take our use pattern, the concept of use patterns, what we would consider as in an educational setting is to create a new use pattern for the hand. So if we consistently teach students or practitioners to use a broad hand with the fingers together, that becomes a new usage pattern. Therefore, any learning that happens in this tactile fashion with treating, as far as palpation is concerned or as far as patient motion is concerned, then what we end up getting is the crossover effect or the learning effect in the whole hand. We want the learning effect in the whole hand to the best of our capacity to increase attention, to increase sensitivity. We may not absolutely increase sensitivity, but we will definitely increase the capacity to pay attention because we've trained the whole hand. So again, as far as the clinical reality is concerned, we want to create a new use pattern, or this is the hypothesis, that we create a new use pattern of the whole hand initially to then identify any motion dysfunction somewhere else in the hand or any asymmetry in motion as we apply the whole hand to the patient's body. So we're considering, again, that there's crossover effect in common use patterns. Why don't we just go ahead and hypothesize that if we create a new common use pattern through extensive training with students and practitioners, that we may actually improve the capacity to palpate. So we've talked about palpation quite a bit in the past, and we've laid out general concepts, but if we go ahead and within those general concepts we plug in the concept of a broad hand, which we already talked about, but a broad hand, and extensively training that, then we may have better capacity to pay attention to the hand as a whole to better identify motion asymmetry, not necessarily specific structures, because we understand that there are issues with that. That's been proven through varying research projects, that as far as accuracy and specificity of palpation we have issues. But again, we're looking at thinking about a new use pattern.